Good afternoon and welcome to today's webinar, Minor Consent, Confidentiality, and Reporting Child Abuse for Title X Providers. My name is Alicia Torres and I'm the Title X Program Manager with the Nevada Primary Care Association. NVPCA is a nonprofit organization dedicated to improving access to high-quality, community-based, affordable primary health care in Nevada. We provide training and technical assistance to health centers and community partners to improve access to health care for all, especially for underserved and vulnerable populations. For more information, visit us at nvpca.org. This training is in partnership between Nevada Primary Care Association and the National Center for Youth Law. And I just want to take a moment to thank the National Center for Youth Law for helping us coordinate this session. Before we get started, I would like to go over a few items so you know how to participate in today's event. During the presentation, please make sure to mute your phone or computer so that we don't have feedback or background noise. Also, please be sure not to put your phone on hold or else we'll hear your hold music. If you need to walk away from your desk, just put us on mute, please. You will have the opportunity to submit your questions for today's presenter by typing in the chat box. And if you have any issues with seeing the presentation or accessing the presentation, please use the chat box to let us know what those issues are. Questions will be collected and addressed during the Q&A session at the end of today's presentation. Today's session will be recorded and slides will be available to participants. And without further ado, I'd like to introduce today's speaker, Rebecca Gudeman from the National Center for Youth Law. Welcome, Rebecca.
Thank you so much, and I'll let everyone know that you're looking at a picture of me with blue hair. I currently do not have blue hair, and the only reason I had blue hair in that photo is I had too many people asking if I was my children's grandparent, and I decided that I needed to make a statement to let them know that I wasn't quite the age they thought I was. So it's my pleasure to share this lunch hour with you all. Today we are going to walk through three different legal topics: consent, confidentiality, and child abuse reporting. Normally when folks walk in the clinic, you're not segregating the work and the conversations you're having into sort of these discrete categories, but we will present them in that order just to keep the law straight. And then at the end, when we're looking at some cases, we can sort of fold them all together. But I mention that because sometimes it feels a little odd to look at a case and only look at sort of one slice of this. I want to flag for everyone that the content in this webinar is based on a manual that we will be sharing hopefully very shortly. This is a manual that we did last in 2011, I believe, and now we've been updating it, so we should be able to share it with you, and it will have all the legal citations and additional information. And because I'm a lawyer and it wouldn't feel right, I'm sure, to you all if I didn't say something like this, we are presenting legal information, not legal advice in this webinar. And while I encourage you to submit questions, to the extent that a question asks for any kind of legal advice, I may need to just defer you to your own legal counsel. So I apologize in advance if that's what what I end up answering to any of the questions you submit. I also want to flag that this is the state of Nevada and federal law as of February 2019. As I'm sure everyone knows, the Federal Department of Health and Human Services have issued new regulations for Title X, but those regulations are not yet in effect. And given both what has lawsuits that have already been filed and that folks say that they plan to file, we actually don't know when these new regulations may go into effect. And so for now, we're presenting what the state of the law is today and what may be the state of the law for a while. Should these new regulations go into effect, we'll change the manual, we'll let you all know, and maybe we'll even do another webinar. Okay, so without further ado, let's jump into consent. This is not specifically Title X in general. Who consents for a minor's healthcare. A minor is anyone under the age of 18. Our general rule is that a minor typically needs a caregiver to consent for their health care, and that is most often a parent, but it may be another kind of legal guardian. It depends on the situation that they're living in. There are a number of state laws that allow others to consent for a minor's care. So for example, in an emergency, anyone standing in loco parentis, meaning in the place of a parent, can consent to emergency care. There's different rules for young people who may be in the juvenile justice system or in the foster care system. And as you all know, there are laws that allow minors to consent to their own care in certain situations. In every state, there are minor consent laws, and we typically divide them into two categories: laws that allow minors to consent based on their status, so their situation in life, and laws that allow minors to consent based on the type of services that they're seeking, because we want to, these services are so important, or we know that there are so many barriers to accessing that care that we really want to make sure that we're keeping every door open for a young person. So while every single state has these laws, each state has sort of a different combination of laws. So let's look at what the state of the law is in Nevada. First, the status exceptions. In any of the following situations, a minor may consent to examination and treatment if they're married or have been married, if they're a mother or they've borne a child, if they've been emancipated by a court. Now, sometimes you may hear a young person come in and say they're emancipated, and what they mean is they're not living with their parents, or their parents aren't involved in their life. But in this case, this actually means that they've gone to court and officially gotten an order that emancipates them legally. They also can consent if they would be in danger of a serious health hazard were they not to receive care, or if they've been living apart from their parents with or without their parents' consent for at least 4 months. Now, in all of these situations, the minor needs to be able to understand the nature and purpose of the exam or treatment they're receiving and the possible outcomes of that care, and voluntarily request it. But in any of those cases, they could consent to the full panoply of possible exams and treatment. In addition, there are service exceptions in the Nevada law. Minors can consent to abortion, to STI, STD examination and treatment, and to treatment for both abuse and related illnesses related to drug and alcohol abuse. In addition, minors can consent to Title X funded care, whether or not there is an explicit Nevada law that also would authorize that. So let's look at that for a sec. This is actually per federal regulation, and what our federal Title X regulations say is that to the extent that a healthcare service is funded in full or in part by Title X money, it must be made available to all adolescents, no matter their age, without the need for parental consent or parental notice. That means even if there is a state law that would otherwise explicitly require parental consent or parental notice, this federal Title X regulation supersedes. So let's just look at two cases. And again, just a quick reminder, encourage you to submit any questions or thoughts you have in the chat box. If I get a chance as we move forward, I'll try to respond in the moment, but we will absolutely have time for a conversation and questions at the end. So this is the case of Angela. Title X provider walks into the exam room to find Angela and Angela's mother. Angela's mom immediately says, "We just found out Angela's been having sex with her boyfriend. We need to get Angela birth control and an STD test." Angela doesn't say a word. So the question is, may Angela's mom consent to these services for her daughter? We didn't even put this up as a quiz for you all because we thought this would hopefully be a pretty straightforward one to answer, because this is a Title X provider and these would be Title X funded services. We don't even need to look back at our Nevada minor consent laws. We know that Angela and only Angela can consent to these services, and Therefore, mom's consent, great that mom's supportive of her. Hopefully mom is supportive. We don't quite know what's going on in this relationship, but we need to make sure that this is actually what Angela wants and that Angela has voluntarily consented to the care. Now let's look at Elena. Elena's 13. She comes to your health center, explains she thinks she may be pregnant. After some discussions, the nurse practitioner decides to do a pregnancy test, some STI testing, and prescribe birth control. Who may consent for Elena's care? Well, in this case, we're not in a Title X funded health center, and so we do need to look to our Nevada minor consent laws. And so that means looking at both our status exceptions and our service exceptions and see whether she's able to consent to anything on her own. So if we go back, we see that in Nevada, minors, and there's no lower age limit, can certainly consent to STI examination and treatment. There's nothing that says that minors may consent to pregnancy-related care like birth control or pregnancy testing explicitly based on the service alone, but we may want to check and see whether Elena meets any of these status exceptions that might otherwise allow her to consent to contraception or to pregnancy testing. So depending on the situation, we may be in a place where Elena can receive some of the services that they'd like to provide, but not all under her own consent, and then they need to have some conversations with Elena about whether this is something that she would feel comfortable getting parent consent for, or whether this is someone we need to send to a Title X clinic to ensure that she receives the services that she needs. Okay, we're already going to do a shift to confidentiality. Again, encourage you to submit any questions if anything came up during the consent that you're wondering about, because we are sort of shifting between these somewhat quickly. So confidentiality, there's a lot of layers of law. At the federal level, we have the Health Insurance Portability and Accountability Act, HIPAA, which sets sort of a ground floor for confidentiality across all the states. But what HIPAA also says is that to the extent that your state has any specific laws that provide greater confidentiality protections, you must comply with your state law. And so often the scope of protections and exceptions will look a little bit different from state to state. And in the manual, we talk a little bit more about how those intersect between Nevada law and HIPAA. But for the purposes of this webinar, we're going to focus on this third prong, because in addition to HIPAA and Nevada state statutes, Title X also has regulations that protect the confidentiality of Title X funded care. And what that says is that to the extent that service was funded in full or in part by Title X money, Title X confidentiality regulations apply. And what that regulation says is that personal client information must be kept confidential, and it can only be released in 3 circumstances. If the clinic has written authorization from the patient, and if that patient is an adolescent, that means the adolescent signs their own release. Can otherwise only be released if the information is necessary to provide services to the patient. So for example, in collaboration with another provider and doing consults or in referrals. Or finally, if a state or federal law requires the information to be released. And as it notes at the bottom, this Title X rule applies in addition to or instead of HIPAA and state medical confidentiality law. So if HIPAA or state law conflicts, Title X supersedes. Now, often there are questions about that last prong. What does it mean if a state or federal law requires release? So let's just look at that for a second. Some examples of required disclosure. Nevada law requires mandated reporters of child abuse to make a report when they have a reasonable suspicion of abuse, and we'll go through those rules a lot more in a second. But because there's no discretion about a report once that duty's been triggered, that is considered a required disclosure, and therefore Title X allows you to comply with that state mandated reporting law. In addition, Nevada has several laws that require, in certain circumstances, that you report when you identify certain communicable diseases, when you've diagnosed someone with a certain disease. Because that disclosure is required, you are allowed to comply with that disclosure requirement, even if the information is otherwise protected by Title X. And similarly, there are laws that require reporting of certain violent acts or injuries, for example, gunshot wounds. If that is required, you're allowed to comply. And in fact, state law requires you to comply. Sometimes folks ask about parent access, particularly as state law may state something slightly different. Title X rules are very clear about whether or not a parent can access the records of their children when the children seek Title X services. Title X, on the one hand, requires that grantees encourage family participation to the extent practical and support clients in communicating with their parents if that is appropriate. But the confidentiality regulation makes very clear that providers and clinics cannot disclose Title X information to parents without the minor's explicit written consent to do that. So this is actually a case that I've heard more than once. I sort of put two different cases together in creating this slide. So in this situation, a woman came storming up to the front desk of this clinic and said she found some paperwork in her daughter's drawer. The paperwork suggested that her daughter had been to that clinic, and it wasn't 100% clear what services she'd received, but it looked like she might have received some contraceptives. She had her cell phone in her hand and said, "I'm going to call my lawyer and I'm going to shut this clinic down if you don't tell me what I want to know right now." So in this case, the clinic called me and said, "Oh my God, what do we do?" This is one where the law is actually very easy, and what's hard is figuring out the best approach to handling it in the situation. So the law makes very clear that without the client's written permission, the clinic cannot share any information with mom in this situation, and in fact can't even confirm whether or not her daughter is a client. But there are ways to prevent this, and often simply saying, because the law says this, I can't tell you, doesn't necessarily create a friendly and helpful and supportive environment. And there are some great tools. There's a toolkit that was created by an organization called the Adolescent Health Working Group. It's called their Minor Consent and Confidentiality Toolkit, and it includes a number of tips on how to have conversations like these with parents and how to frame them, and even includes some sample letters and sample scripts to use with family when you're trying to foster communication and help them understand why encouraging their children to seek health care when they think they need it might be a good thing. All right, now this is another case that we hear often because there are so many folks who provide a combination of services. Perhaps you provide some Title X services, but you also provide services that aren't Title X. Maybe you're a federally qualified health center and you see a range of clients. So in this case, the clinic with the Title X contract also provides general health care to adolescents. Mom brings her daughter in for a possible throat and ear infection, but while meeting privately with the daughter suggests she's interested in birth control. So what information does mom have a right to receive, and how does the clinic document? Well, in this case, we haven't even provided any birth control yet, but there may be a situation in which under the same client's records, we have services that mom consented to, used whatever other insurance program that wasn't Title X, and that mom has access to those records. So mom would have access, for example, to the throat and ear infection information in her daughter's records. But if daughter independently comes in and seeks birth control, and they use Title X funding to provide her that service, the daughter has the right to limit her mom's access to that birth control record. It is the daughter's decision whether or not her mom can see that. And so it is incumbent on the clinic to set up a documentation system or client record system that allows you, or allows the administrator who would receive this request, to segregate records that minors can control access to from records that parent or guardian would be able to access, so that you're not inadvertently disclosing information. And sometimes that can be easy if they're coming in on separate visits, but for example, in this case, when they in the same visit, you may be providing different kinds of counseling or different kinds of services. It can be really helpful to have some policy or protocol about how to document. And I'll just add that HIPAA, in addition to including privacy regulations, also has some security and administrative requirements that all clinics need to comply with that sort of support what I was just saying, that obligate clinics to set up sort of administrative and security controls that ensure records are being appropriately segregated between records that a minor might control and records that a parent might control. All right, as we said before, Title X regulations require healthcare providers to comply with any applicable state mandated abuse reporting law. Title X regulations do not include their own child abuse reporting requirements. Federal law does not have any mandated reporting requirement in it. So when they mandate complying with child abuse reporting requirements, they simply mean follow your state law. But we do need to make sure that every Title X grantee knows what their state law is and knows how to comply with it. So what is Nevada's child abuse reporting mandate? Nevada law requires mandated reporters to make a child abuse report whenever they have reasonable cause to believe that abuse has occurred, and as part of making that report, must share information necessary to make the report. So that doesn't mean the entire client file is open, but any information that might be related to the abuse or neglect that you're reporting would be disclosable appropriately so in making that report. Who's the mandated reporter? It's actually you'll see in the manual, it's listed by license category, but it includes most licensed healthcare providers, physicians, psychologists, nurses, MFTs. It also includes any personnel who are engaged in the admission, examination, care, or treatment of persons, or an administrator or manager. Excuse me. So there may well be staff in your clinic who are not health providers themselves, but are mandated reporters. And there may be some folks on staff who are not mandated reporters. And so one thing to consider is whether your clinic policy makes any provision for what happens when that person on staff who's not a mandated reporter sees or hears something that would have otherwise triggered reporting. Do they report it to their supervisor? What is the approach? What are they supposed to do? All right, so when is a report required? Reporters must report when in their professional or occupational capacity they know or have reasonable cause to believe that a child's been abused or neglected. Not every state has this caveat regarding professional or occupational capacity. This means that while you may be a mandated reporter in your office, when you're off work and you're in the supermarket and you see something happen that looks like abuse or neglect, you are not a mandated reporter. You certainly have the option to voluntarily report. But sometimes that question comes up because folks may see a client out in the community. They may see something happening and they know who that person is because it's someone they've seen in their office, and they wonder whether they're required to report or not. And again, there's nothing saying you can't, but the mandate to report and the legal obligation to report is triggered only when the information arises in your professional or occupational capacity. So what is reportable? State law requires reporting of child abuse or neglect, and that is in turn defined to mean physical or mental injury of a non-accidental nature, sexual abuse or exploitation, or negligent treatment. And now each of these is in turn defined by state law. So what's reportable as a physical injury includes but is not limited to non-accidental injuries such as sprains or dislocations, fractures, hemorrhages, burning, scalding, cuts, punctures, bites. These are very specific examples, and the law is clear that it includes and is not limited to that. But what is critical is that caveat that it's a non-accidental injury. What's reportable as a mental injury? Any injury to the intellectual or psychological capacity or the emotional condition of the child is evidenced by an observable and ability of the child to function within a normal range, performance, or behavior. So let's look at a case. Molly is 16 and at the Family Planning Center for a pregnancy test. The clinician notices some bruising on Molly's face, and Molly says, "Oh yeah, me and my boyfriend, we got into it." So would you report this as child abuse? And now this time we're actually going to turn to you all and ask you whether you would report this, given the information you have so far. So we'll just take about 30 seconds, type in your answer, and we'll see where folks are on this.
Okay, it looks like we have 67% said yes and 33% said no.
Okay, great. I'm glad that we're not all in the same place. So let's just look at this case for a second. So intimate partner violence is something that the Title X program specifically calls out and wants to make sure that every Title X provider understands whether intimate partner violence is reportable under state law under the state child abuse reporting law. Intimate partner violence is defined by the Centers for Disease Control as physical and/or sexual violence or threats of physical and sexual violence. It also includes psychological and emotional abuse, including coercive tactics that both adults or adolescents may use against a current or former intimate partner. Now, even though this definition includes both adults and adolescents, there is some evidence that the way that aggression in adolescent relationships plays out looks a little bit different than it does in adult relationships. This chart is a little bit hard to read, but the bottom line, it's reporting from 3 different studies of the interpretation of the male, the interpretation of the female, and interpretation of the third party about sort of who was the aggressor in a relationship that included physical violence. And like I said, it's a little bit hard to read, but what you'll see is that it actually was somewhat split up. So it's not necessarily obvious who is considered the aggressor, who's considered, even if this is a case of intimate partner violence. So in the case of Molly, some folks say this is reportable. It certainly could meet this definition of a reportable physical injury. Some folks said they didn't know, and some folks might say, you know what, I need more information. I need to talk to Molly and find out what it means when you say you got into it, what the relationship looks like, and all of those are legitimate answers. I'm not going to say that there's one correct answer in this case. The key is that you're using your professional judgment in deciding whether this particular standard of reportable child abuse, reportable physical injury applies in this case. And as long as you can say that you used your professional judgment and your expertise to make that decision, you are applying child abuse reporting law appropriately. Okay, what is reportable as negligent treatment? Negligent treatment occurs if a child's been abandoned, is without proper care, control, and supervision, or lacks of subsistence, education, shelter, medical care, or other care necessary for the well-being of the child because of the faults or habits of the person responsible for the welfare of the child, or the neglect or refusal of the person to provide them when able to do so. What is sexual exploitation? Reportable sexual exploitation. It includes forcing or allowing or encouraging a child to solicit for or engage in prostitution, to view pornographic film or literature, or to engage in either filming, photographing, or recording on videotape, or posing, modeling, depiction of a live performance before an audience, which involves the exhibition of a child's genitals or any sexual conduct. Now, you'll just see from the language on this slide that this law was written several years ago, let's just say, if they're talking about videotape, for example, and soliciting or engaging in prostitution certainly makes obvious what they're trying to capture, but it doesn't really capture the language that we now use when we're talking about young people who may be the victims of trafficking. And the Title X program asks us to explicitly clarify whether or not sexual trafficking is reportable under child abuse statutes. So let's just look at the definition of what is considered trafficking. This is from federal law. So under federal law, human trafficking includes any when someone is 18 or older, that they've been involved in commercial sex through force, fraud, or coercion. When the victim is under age 18, it's anyone involved in commercial sex. So there's no requirement to demonstrate that they have been forced or coerced to engage in commercial sexual activity, or that they've been brought into it in a fraudulent way. The fact that they're engaging in commercial sex, by definition, makes them a victim of trafficking. And the third category includes adults or minors in forced labor or involuntary servitude. When folks ask whether trafficking of a young person is reportable as child abuse, the best we can say is that first bullet, to solicit for or engage in prostitution, aligns as best as we can with that second category. And so in most cases, it would be reportable. What is sexual abuse that's reportable? It's defined in Nevada in reference to criminal law and includes references to the statute that makes incest criminal, lewdness with a child, sadomasochistic abuse, sexual assault, statutory sexual seduction, and mutilation of the genitalia of a female child. But of course, just simply looking at those doesn't give us much to work with. So let's look at what the actual criminal statutes say. So what is sexual assault for reporting purposes? It occurs when a person subjects another person to sexual penetration or forces another person to make a sexual penetration on himself or herself or another or on a beast, and it's either against the will of the victim or under conditions in which the perpetrator knows or should know that the victim is mentally or physically incapable of resisting or understanding the nature of his or her contact. And penetration in Nevada law means any entry, even small, into any genital or anal opening. What is sexual activity reportable based on the age of the minor? So separate and apart from whether it's against the will of the victim or whether the victim was competent to provide consent, even if this is voluntary, when would it be reportable? Any sexual penetration committed by a person 18 years of age or older with a person who's 14 or 15 and at least 4 years younger than the perpetrator, or any sexual penetration upon or with a child under the age of 14, irrespective of the age of the other person. So it takes a little bit of math to sort of figure that out, but what we also need to add in there, it also includes any lewd or lascivious act upon or with the body of a child under the age of 16, committed by someone who's 18 or older, or any lewd or lascivious act upon or with the body of a child under the age of 14. And a lewd or lascivious act means touching with sort of a sexual intent. So it's trying to capture some of the behavior that may not quite rise to the level of sexual penetration or sexual intercourse, but that is clearly assaultive. So what are the situations in which voluntary sexual activity by a minor would not be reportable as child abuse? So there may be others, but what we can say for sure is that sexual activity between minors who are each 14, 15, 16, or 17, or sexual activity between one person who's 16 or older and a partner who's 16 or older are not reportable as long as there's no reasonable suspicion that somebody was forced or subjected to the sexual activity, and there's no suspicion that one person was mentally or physically incapable of resisting or understanding the nature of the conduct. Okay, so that was a lot. I want to go to some cases that will help us apply some of what we just went through. So our first case is Layla. She's 14 at the Title X clinic for a pregnancy test, discloses her adult uncle made me do it with him, and she thinks she may be pregnant. Pregnancy test confirms that she, in fact, is pregnant. So next question to you all. Must the clinician make a child abuse report in this case? All right, yes. We thought we'd start with an easy one. So yes, this is incest, clearly reportable, as 100% of you also agreed. Okay, let's go to our next case. Our next case is Brianna. She's 17. She comes to the Title X Center requesting emergency contraception and an STI screen. She says she was at a party Saturday night and got really wasted. She had sex with another 17-year-old and is concerned about pregnancy and STI. Is this reportable? So again, we're going to give you a chance to tell us whether you think this is reportable. And if you would possibly want more information, I would suggest voting no. Okay, so we have 20% yes, 80% no. This is another situation where I'm not going to say there's an absolute clear-cut yes or no, but just to review what is reportable, we do know that any sexual activity that occurred under force or coercion against the will of one person is reportable. We also know that any sexual activity that occurred under conditions in which a perpetrator knows or should know that the victim is mentally or physically incapable of resisting or understanding is considered sexual assault and is reportable. So certainly, since she mentioned being wasted, we may want to ask some questions about this, or you may, from the context, already have decided that I have a reasonable suspicion that this meets the definition of sexual assault, because again, you're not required to be an investigator, you're simply required to report when you have a reasonable suspicion. And so for those of you who said yes, if you feel like this information provided you sufficient facts to trigger a reasonable suspicion, then you are right. For others, you may decide, I want to ask Brianna a few more questions, and then I'll decide whether this has suggests that she, in fact, was unable to consent. Now, would this be reportable based on age alone? Well, we know that absent any suspicion of force or any suspicion that she was incapable of consent, 2 17-year-olds engaging in sexual activity is not reportable based on age alone. All right, next case, Eliana. She's 17. She comes in for a pregnancy test. The result is positive, and she tells the clinician that her 19-year-old boyfriend and mother will be really happy with this news. Does the clinician need to make a child abuse report? So again, we're going to ask you to give us your answer, give you about 20 seconds, and we'll see where everyone stands on this. All right, 100% no. Yeah, so, you know, anytime we've got someone under 18 who's engaging what sounds like clearly voluntary sexual activity, we still need to check our ages to make sure that this doesn't trigger reporting based on age alone. But in this case, we've got both parties are over 16, so that is not going to require us to make a report. Okay, our final case, Belinda, 17, comes in to request being tested for everything. She actually says, I don't want any kind of insurance. I'm just going to pay cash. She's someone that you've seen before. She's been in every month for the past 3 months for similar services. And this time she's accompanied by an adult, and she has in the past also been accompanied by the same adult male who waits quietly in the waiting room until the appointment is over. Is this reportable? So again, we're going to give you a chance to answer whether you would report this. Give you about 20 seconds, and then we'll see where everyone is. Okay, so 75% say yes, 25% say no. Sounds like folks are rightly considering what's happening in this situation. You know, the key thing to get from this case is this is someone who has some red flags going up, suggesting that she may be in a situation of being trafficked. So it may be enough for you to already decide, I need to report this. It may be enough for you to say, I need to ask a few more questions. But that is certainly something we want to consider. And if you have reasonable suspicion that she's been trafficked, then you would, of course, make a report. Okay, so you decide a report is necessary. What does that entail? Once you decide that report's necessary, you must make the report as soon as reasonably practical, but no later than 24 hours after you decide that a report is required. And you can report by telephone or any other means, oral, written, or electronic. They want to make it easy for you to make that report as quickly as possible. And that report can go either to child welfare or to law enforcement. I'm actually going to skip that slide just to make sure we have, well, actually, I'll just quickly state again in the Adolescent Health Working Group toolkit, there's some great tools and sample scripts to help you frame conversations with young people so that they're never surprised when you suddenly say, we need to make a child abuse report. And part of that means when you're first when you're first introducing yourself to your client, setting the stage by explaining both what confidentiality protections they have, but also delineating exceptions, including situations that might trigger reporting. And then when you decide that a report is required, you want to frame the mandate to report in the context of providing help. So you don't want to say, well, I have to report because the law requires me to do so. You're saying we're reporting because we care about you, we want to get you help, we want to get you services or protection or whatever is appropriate. And when you have situations, particularly something like a situation with Belinda, where we've got someone literally waiting for her in the waiting room that we may be concerned with, before you even worry about reporting, it's okay to worry about safety. Ask them about safety, think about doing some safety planning, providing information or helping arrange for alternate placement, or for somebody to come in and immediately make sure that someone is safe if that's necessary. And depending on, it may be someone who's being trafficked, it may be someone who's in a very abusive parental situation, and something like, let's say, a pregnancy might trigger some real safety concerns. Okay, so with that, I actually want to turn to your questions. We want to make sure you have time both to ask questions, but also share any cases or comments. And another thing that we're encouraging you to do, and you can do it either through the chat box or later, as we noted, we are updating the manual that includes all of the information in this webinar, but in much sort of richer depth. But if there are topics or questions that we didn't touch and that you would love to see addressed in the manual, now's your chance to let us know, either through the chat box or later through an email to either organization, because we want to make sure that the manual is as responsive as we can make it. Okay, so I'm going to go to the questions that have come in thus far. First question, back to our consent laws. How can you verify if an adolescent's been living apart from their parents for more than 4 months? So if this would be whether they meet that status exception that allows them to consent on their own behalf. The law doesn't mandate a specific protocol or procedure for you to prove that. So what sort of the good and bad answer is, it means it's up to your clinic and your risk management and your attorneys to decide how you want to handle that. I will say that I have seen some clinics, for example, create a document that they have their minor patients fill out, and it's sort of check boxes, and they answer, you know, have you been living apart from your parents? How long have you been living apart for 4 months or longer? And then the minor has to sign it under penalty of perjury. Their risk management and their attorneys have decided that's sufficient for them, because of course, you know, none of us carry around papers with us that prove how long we've been living where we're living. It's not like there's an apartment rental contract that they could use. So it's ultimately going to be up to your clinic, but just providing that one example is something that I've seen one clinic adopt as a way to document that they try to at least make sure that the young person meets those criteria. All right, next question. Can you please provide the federal citation for federal law providing access to services without parental consent? This is Title 10 regulations, and there's it's sort of Title 10 regulation and then several cases, federal cases that interpreted application of that federal regulation. And actually the manual provides all of that citation in full, including the case law and the case names. So rather than trying to read it out to you over the webinar right now, let's just make sure we get everyone a copy of the manual when it comes out, which hopefully will be very soon. All right, so this is a question about our case of Belinda. Belinda presented at a Title X funded clinic. Even though she declined Title X funding, is she still covered by the Title X protection? So that's a great question. Let's go back to Belinda. In this case, Belinda said, no, I just want to pay cash. Title X confidentiality and consent rules only apply when a service is funded in full or in part by Title X. So that means that Belinda may be operating under Nevada law in this case. So under Nevada law, she's allowed to consent to any STI exam or treatment on her own behalf. And she also can consent to other services if she has been living apart from her parents for at least 4 months, or going without that service may put her at a serious health risk. But it absolutely would be the right thing to make sure that she meets one of those criteria before you proceed with services. And in terms of child abuse reporting, no matter what funding source or type of clinic, all clinicians would be subject to mandated child abuse reporting law. So we would still follow that protocol in terms of deciding whether we report this to child welfare or to law enforcement. Okay, next question. If a minor patient is in the clinic for a routine acute visit and was referred and has parental consent to participate in a teen pregnancy prevention evidence-based program, and they ask for birth control or STI testing, will Title X kick in and thus Title X consent and confidentiality? Okay, so I sort of can answer that and I sort of can't. I think what this sounds like we have someone coming in for what sounds like maybe an education program, and then they're independently saying to you, hey, separate and apart from this education program, I would like to get some health services, and these happen to be health services that are covered by Title X. If someone in that education program wants to set up an appointment, and it's as if they came in through the, if this person had just come in off the street and asked for those appointments, they would certainly be covered by Title X. It's just that they're not coming in off the street, they're coming from one room to another. Title X would apply, but it might behoove a clinic in that situation to talk about protocols or procedures to put in place to just really make sure that you're keeping those two things separate, so that parents define, so that there's no way that documentation crisscrosses or that it looks in any way like those Title X services were being provided as part of that education program. But that development of that kind of protocol would be really up to the clinic. And ultimately the answer to this is, if somebody is an adolescent and they come to you and ask for a Title X health service, you have the right to provide that service based on the adolescent's consent, and the adolescent would be able to control who can receive information about it and whether their parent could receive information about it. Okay, it looks like that actually is the end of the questions that were entered in the chat box. I don't know if anyone has anything else they want to add, or if anyone sent anything privately to you all, Brandy. But if that is it, we may be at the end of the presentation. I would just close by encouraging you to think about any additional information you might want to see in the manual and letting us know afterwards. You can send an email to me or to the Nevada Primary Care Association, and we have a little bit of time to get that. If you want to send us anything, send it now, because we have a little bit of time to get that in, and we really want to make this manual responsive to your questions and needs. So please think about it and send us any thoughts you have. And with that, I'll turn it back to you, Brandy.
Sure, thank you. If anyone would like to ask any other questions, you can raise your hand in your chat box and I'll unmute you. I am not seeing any other questions. So please, if you have any other questions, please feel free to contact us. Thank you, Rebecca, and thank you to everyone for attending today's webinar. Alicia will be following up with an email with the slides, the guide, and then a link to our recorded presentation. Once you leave today's webinar, you'll receive a survey on the presentation, and we'd appreciate if you'd complete that and provide your feedback. On behalf of Nevada Primary Care Association, thank you for joining us today, and have a great rest of your day.